I would like to start this session by inviting to the stage Dr. Ahmed Al-Mandhari, my ex-boss, and he is the Regional Director of the WHO Eastern Mediterranean region, to give his keynote speech. Dr. Ahmed.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good morning to every one of you. Excellencies, distinguished colleagues, ladies and gentlemen. It is a great privilege for me to be here at this crucial conference focusing on people at the heart of health services in peace and crisis. I would like to talk about how we need to transform hospitals to help achieve universal health coverage. Universal health coverage means that all people and communities can use the promotive, preventive, curative, rehabilitative and palliative health services they need, of sufficient quality to be effective without facing financial hardship. To achieve this, it is essential to transform the way health and social services are planned, delivered and funded in order to deliver integrated, people-centered health services. In this vision, adopting a primary healthcare approach and strengthening primary healthcare is the foundation for achieving universal health coverage and the health-related targets of the Sustainable Development Goals. The primary healthcare approach applies to all providers in the healthcare ecosystem, including hospitals. As you all know, hospitals play a vital role in health service delivery systems. That makes them essential for universal health coverage. We must stop dichotomizing between primary health care, first level care, and hospitals, which are considered as referral care. Universal health coverage can only be achieved if both elements work together. Quality primary care requires quality referral care, and vice versa. Ensuring that people everywhere, and especially the most vulnerable, have access to referral care and inpatient care when they need it remains an unfulfilled goal at a global level and specifically in our region. The hospital sector needs to be transformed. We need to scrutinize hospital rules, functions, and operations through an integrated and people-centered lens. Hospital transformation entails finding new ways of integrating hospital services within the broader service delivery system, particularly primary healthcare, engaging and empowering communities and other social services, improving hospital management and performance, and creating an enabling environment. The Eastern Mediterranean region faces many challenges. Far too many of our people lack the service or lack the healthcare they need. When services are provided, they are often poor quality and have limited effect. Even in those countries with adequate resources, health systems are often suboptimal and many people make unhealthy life choices. And of course, on top of all of this, many countries face the devastating health and humanitarian consequences of emergency on unprecedented scale. More than half of the region's population live in countries with graded emergencies. Most countries in the region have a mix of public and private hospitals, but around 4/5 of all hospital beds are in the public sector. Many countries struggle to improve hospital planning and management at both facilities and health system levels due to rapidly evolving demand on hospitals, major shortcomings in the health sector generally, and more specifically deficiencies within the hospitals. In some countries in emergencies, many hospitals and hospital services have been seriously affected by conflict. Transformation of the hospital sector can be achieved through two complementary, interrelated approaches: hospitals for integrated health systems and integrated health services within hospitals. The path to transformation should be adapted to the local context, take into account each country's priorities, resources, and capacities. Distinguished colleagues, 6 weeks ago, I was honored to join WHO's Director General and colleagues attending the first high-level meeting on universal health coverage of the United Nations General Assembly. It was a landmark event And world leaders issued a political declaration committing to step up actions to advance towards universal health coverage as one of the Sustainable Development Goals. The Eastern Mediterranean region has already led the world in making such a clear public commitment. In September 2018, all our countries signed the Universal Health Coverage 2030 Global Compact and endorsed the Salalah Declaration, pledging to work together to accelerate progress towards universal health coverage based on primary health care. WHO is working with our member states to enhance their health systems. Our regional framework for action on advancing universal health coverage is designed to guide countries in identifying and implementing the measures they need to take. And that support is now reinforced by our new regional strategy in support of our vision for public health in the region, Vision 2023, which aims to focus our work for maximum impact. We also recently developed a regional framework for action for hospital sector to support member states in developing a roadmap for hospital transformation in line with each country's universal health coverage plan. Excellencies, distinguished colleagues, ladies and gentlemen, I am pleased that this conference is focusing on people at the heart of health services in peace and crisis, a critical theme to tackle. We look forward to further collaborate between WHO and the International Hospital Federation to improve healthcare planning and management in the region. I would like to express my sincere gratitude and appreciations to His Excellency Dr. Saidi, Minister of Health of Oman, for hosting this important event in the region. And let me once again thank you for inviting WHO to this important conference. And I look forward to the discussions and wish you a very successful meeting. Thank you very much.
Thank you very much, Dr. Ahmed, for your kind words. Next is going to be a video by the Director General of the WHO, Dr. Tedros Ghebreyesus. And he's going to give us a talk since he could not be with us today.
Excellencies, dear colleagues and friends, at the last United Nations General Assembly in September, all 193 UN member states approved the political declaration on universal health coverage. Hospitals play a key role in realizing that vision. They are a central part of every health system and contribute to building strong primary health care. Hospitals are critical for communities, both routinely and in response to outbreaks and emergencies. Yet hospitals and health workers are often affected by emergencies, with the result that services cannot be delivered to affected communities when they are most needed. Globally, 40% of countries have fewer than 18 hospital beds for every 10,000 people, well below the number needed to achieve the Sustainable Development Goals. Too often, people find hospitals bewildering and impersonal. While buildings and infrastructure are necessary, we must prioritize transforming what hospitals do and how they do it. As part of a strong health system built on primary health care, hospitals should develop a population health approach and become a resource hub serving local health providers. WHO is committed to working with you all to make hospitals the best they can be for a healthier, safer, and fairer world. I thank you. Shukran jazilan.
Now I would like to invite to the stage our second keynote speaker, Dr. Edward Kelley, who is the Director of the Department of Integral Health Services at the WHO. He's going to talk about rethinking hospitals' roles and position in the health system for the primary health care and universal health coverage. Dr. Edward.
Thank you very much to our moderator and for the expert leading that you've had. And Excellencies, Minister of Afghanistan, my good friend, Minister of Oman, and my very good friend and also second boss, the regional director. It's a great honor to once again be here in Oman. When I started my career at WHO, I came to direct a major initiative on patient safety that WHO had, the World Alliance for Patient Safety, and Oman was always the place where we came with the friendliest welcome on the issues of patient safety. Many meetings here with the Gulf Cooperation Council, GCC ministers discussing on quality and safety. So it's great to be back here to talk about perhaps even broader issues, sort of the place of hospitals within healthcare reform and within our work. I just have the briefest job of trying to frame the question of hospitals within universal health coverage and integrated service delivery, and I'll try to do so in a way that references the pieces that the regional director have noted, and also our director general in terms of universal health coverage and the high-level political declaration. It also is an opportunity to come here in service of the region. Our own our own director general has changed the way of working of WHO to really look at holistic issues and to put headquarters really in service of regions and countries much more so than in the past. That hasn't always been the case, and so being here is a great honor. This political declaration looks at the health system and the delivery of healthcare across the range of health services, and this is one of the first times in the most comprehensive way. The Secretary General said this himself on the floor of the high-level meeting, for which I was the rapporteur for the high-level meeting, saying that this was the most comprehensive examination of health in New York with heads of state that we've ever had, and being able to look across the range of health services and the way that they are organized is really a groundbreaking examination of the issues of health services within this big goal that we have of universal health coverage. And the news is not so good, actually. We are not on track to achieve the Sustainable Development Goals related to allowing people access to quality health services. We are going in the right direction. The WHC monitoring report, I worked on it quite a bit myself, showed that we do have progress in terms of service coverage across countries. We are doing a better job of getting services to people where they need it. But we're not doing a good enough job. We are not on target to reach the goals that we've set for the Sustainable Development Goals. And in addition, we are going in the wrong direction in terms of the financial impact that this is having on families. Catastrophic health spending and the gap between what people are able to pay for out of pocket and what they're having to pay for out of pocket rather, and what they're having to put forward in terms of the health services is growing. And this is one of the big gaps that we have to address in terms of the universal health coverage goals. It's quite clear that these questions have direct relation to what we're talking about at this conference and the role of hospitals. Spending at hospital level is one of the key drivers for this catastrophic health expenditure. And it's quite clear that at a national level, at a global level across countries, that spending more, as many of you in the room already know, is not the solution necessarily. Here you can see a curve of countries with the size of the bubble, denoting the size of the population. We haven't labeled them. Later in the afternoon, I'll show Minister Oman which bubble is Oman. But you can see that there is a curve that shows as you start to spend more, you start to achieve less and less gain. So finding that right balance between spending and effectiveness is obviously something for each country and each locality to work on. But it shows us that the issue now is really an agenda not just of cost containment, but of equity and of reaching those populations that have not been reached. In terms of the challenges that we have going forward, some of the issues that have been alluded to already by the regional director and the director general are directly relevant to the discussions here with colleagues at the IHF Congress. 400 million people lack access to essential services. And if you look across different regions, many of them are struggling both with at the primary care level as well as with how to refer patients up the chain. So the issue is not just can people find a door of a community clinic to walk through, but how do they then get the specialized services that they can reach? WHO has often cited that 40% of healthcare spending is wasted through inefficiency. Big portions of that come at higher levels of the health system. Now we have in many places a global development engine that has been focused on communicable diseases, but actually the burden across all regions of WHO is focused on non-communicable diseases, and something that this region has focused on very strongly under the RD's leadership. But still there's problems of trust, and I'll come back to this at the end, and people's ratings of the services that they receive. In Africa, for instance, 45% of those surveyed rate their involvement in decision-making as being poor, and we still, even now, we don't even talk about the decades that we have worked on patient safety since I've been working on it. Still 1 in 10 hospitalizations result in harm to patients, and that is across all settings. It's the same in Europe as it is in other parts, in many of the studies that we've conducted in the Afro region. We have one sort of answer to this, if we are really considering this. One answer to health services that they can be oriented in the way that will solve the majority of these problems, and that is looking at the delivery of care focused on people, not around diseases and not around the level of the health system. And just a short video that we did that tries to describe what people-centered health services is, if we could just show this.
Around the world, people are living longer, but often with multiple diseases and conditions that require care over many years. And unfortunately, too many people are not informed or consulted in the care they receive. In some countries, only 1 in 3 people have the risks of their treatment explained to them. 1 in 5 people have at least one unnecessary test. And up to 40% of health spending is wasted due to inefficiency. Healthcare should not be like this. Remember, people live with their condition 24/7, not only when they seek care. That's why people-centered care is so important. People-centered care means ensuring that health services are tailored to people's needs and are provided in partnership with them rather than simply given to them. It means care where people, families, and communities are respected, informed, engaged, supported, and treated with dignity and compassion. People-centered care can have lasting benefits. It improves the trust, experience, and outcomes people have from care, the confidence and job satisfaction of health professionals, and the quality and efficiency of health systems. People-centered care can increase access to health services and reduce unnecessary use of services. Ultimately, it means people get the right care at the right time and in the right place. But too often, this type of care is not standard practice. Implementing people-centered care requires fundamental changes in our approach to healthcare. It means rethinking how health services are organized, managed, and delivered. It means shifting away from asking, "What is the matter with you?" to "What matters to you?" Around the World Health Organization is working with countries to design health systems that put people and their needs at the center of care. Because that's the health care that everyone deserves.
So this video we did partially in preparation for the global conference on primary healthcare, and so the whole point of this conference that we have here in this World Congress that WHO has been very honored to work with our partners at IHF to help support, is to answer this question: what is the place of hospitals in today's people-centered health system, in both the policy and technical environment? You would not think that the conference titled Global Conference on Primary Healthcare would be core to the mission on hospitals, but actually Eric and the team were there with us working because WHO believes that we will never achieve the vision that came from the Astana Declaration and then from the high-level meeting presentation without the reform of hospitals. That is, will be, if there's one thing that we will do that will address the challenges in primary healthcare, it is to work on reforming and reorienting hospital care. The conference brought out many particular issues in terms of the work that we've had together, but it showed a redefinition or a sort of renewal of the definition in the Declaration of Astana on primary health care. It showed primary health care, of course, being the integrated service delivery with considering of essential public health functions that are of high quality, safe, and oriented towards people, but supported by multiple sectors, and that means education and transport, et cetera, energy, and serving engaged and empowered communities. And you would not think that that would be a controversial topic, but actually we debated for many, many hours about how to frame that in a way that fits all countries, and I think that this is something that is collectively a global challenge. I'll just end with a few thoughts on, because it's really not for WHO to say how this agenda should come. This is what this conference is for, but it is really, we have a new, renewed focus on hospitals and their place within this agenda. Hospitals are essential if we are going to make this transformation. They're key to UHC, but unfortunately, at present, if you look across the globe, we're not delivering as we should. We are too often disease-oriented still in our delivery. And the integration with primary health care has not been there in a strong enough way. Hospitals are politically very visible elements of all countries' healthcare systems, and citizens have great expectations related to them. But right now, if you look across the world, the public does not trust its healthcare system in general across most countries. And a big piece of that is a problematic or difficult relationship trusting big hospitals that exist. Overcrowding, waiting times, scandals, and corruption all cloud some of our relationships with our public. And we can't afford to waste some of these resources. In many of the places, and being an American, I can speak with definitive case that we spend a lot of money in the hospital sector, we globally, but also in my country, and we don't get enough for what we are spending. The uneven distribution of some of the services that we have means that we're not able to deliver properly. This renewed agenda on hospitals towards UHC has these three concepts: that hospitals matter to people, that people matter to hospitals, and hospitals matter to health systems. That a hospital is an organization that provides emergency care and acute inpatient care, but it must also complement and amplify effectiveness of providers at other levels. It needs to play a critical role in minimizing the impact of emergencies, and we have several sessions at the conference that will look at this in much more depth. And it also needs, as usual, to continue to provide that setting for education and as a base for clinical research. Of course, WHO has a history with hospitals, and it goes well back, deep into the archives as we dug to get this marvelous black and white picture of our former Director General Halfdan Mahler following up on the promises of the Alma-Ata Declaration at the conference in the region in Pakistan in 1981, where the expert committee on hospitals then following up on that stated that hospitals must seek to promote the health of the whole population. And here, the link and the work on health promoting hospitals presents an amazing opportunity that already RD has underlined, and I think we can look at together at the conference and in a follow-up. The transformative vision of community and people-centered hospitals shows that if we organize around people's needs and preferences, we can contribute to building stronger health systems, and we can lead by example with sustainable development that helps us achieve all of the sustainable development goals. Hospitals, as I said, they do directly deliver care, but they can also facilitate synergies, the support, and the supervision with other providers within the system, sometimes directly, as in some models that are presented in even folks in the room here, and sometimes indirectly with working within local and regional delivery models. We can work within our walls, but we can also work in alternative care settings. And actually, some of the biggest questions we will tackle with the non-communicable disease agenda is not how we treat people in our inpatient beds, but it's how well we help them get to other settings and how well we follow them up so that they do not come back and are readmitted to our hospitals. We can provide multi-specialty care and subspecialty treatment, but we can also help with the management of chronic disease, rehab services, palliative care, and the link with social services is the big question that we must tackle. So approaches to hospital transformation are both an internal question and an external question. The internal role in terms of trying to strengthen hospital performance is at the heart of integrated people-centered care. That is the spirit that can help drive internal reform. And externally, people-centered services can help us foster a new social care model with strong hospital engagement. The WHO has just recently finished work. It was a sort of mammoth piece of work. My colleague Ann Leesky-Seth, who's here and can speak with you about it, on a major position paper on hospitals. First one in a very, very, very long time. Anyway, we were using black and white photos back the last time we published something major on hospitals, and we weren't taking photos with our phones. But this has been completed, and the regional director noted the very landmark moment of this regional framework on action for the hospital sector. WHO is a big bureaucracy, but it changes slowly, but it is changing, and recognizing and working with IHF and with partners around hospitals at the heart of integrated people-centered health services to achieve the universal health coverage and the sustainable development goals is one of them. And I'm proud to be here as part of it. Thank you to our host, and thank you to IHF for having us.